I want to talk to you about COVID-19, or the coronavirus that you're hearing about in the news today. There is no need to panic. As Carolina's healthcare system Blue Ridge, we are already in preparations should the coronavirus hit Burke County. Please don't panic. This is different than other things that we've dealt with in the past, but we are putting all of our resources into making sure that you, our teammate, and our employees stay safe. We are well prepared to take care of patients that may present with COVID-19. We have put a moratorium on large meetings and on business travel as the governor recommended. So any event that Blue Ridge would have held has been canceled until further notice. As you know, the coronavirus has hit Burke County, and we do have a patient at Carolina's healthcare system Blue Ridge. So don't be afraid, stay courageous, do what you do every single day, which is take care of our patients.
Through their dedication and commitment and their skills, they will bring us to the light at the end of the tunnel. So we just wanted to come this morning and say thank you on behalf of Burke County Law Enforcement. Thank you so very much. We do appreciate you, we honor, and we are praying for you. Thank you.
And we wanted to show our appreciation and support for the hospital staff and for Burke County EMS for all they've done during this COVID-19 pandemic. I think every fire department in Burke County is here. We'd like to tell all the hospital staff that we appreciate them. We appreciate all they're doing, the risks that they take every day in protecting their community.
It's been hard. It's been challenging, but there have been some success stories. There's been stories of hope, stories of sadness. It has made our organization grow. It's made the country grow. It's made the world mature in a certain way. It made us all cognizant about how fragile, humanity is.
We have the first of its kind COVID-19 virtual hospital, which allows COVID-positive patients to receive care in the comfort of their own home.
Seeing everybody work together and do what we need to do to get through the pandemic was just amazing. And going through that as a team has formed bonds that we'll never be able to break. Like even now, our critical care unit is stronger than ever because of what we faced before.
Thank you for using your gifts and talents, your unwavering commitment, and your sincere dedication to serving the ones who need you.
We are constantly busy, we're working extra days, it's hard, but it's fulfilling at the same time, seeing that this person was so bad, you didn't think was gonna make it, and turn around, walking out the hospital, going home, looking 100%.
Here at CHS Blue Ridge, we have rapid coronavirus testing. We have the ability to get our results about 3 days faster than some other local facilities. In our hospital, we can actually get results in about an hour.
We are leading the way forward.
We know the situation has not been easy. I want you to know that we hear your concerns about caring for sick loved ones, child care and homeschooling, working overtime, and often under stressful conditions, missing family, and vacations.
I still take care of myself, wash my hand in and out, clean my workstation, make sure I'm clean before I go home. It has made me stronger, open up my eye more. You see your family member, you love them, you tell them, I love you. You don't hold grudge like you used to. It is what it is. If I don't see you, I'm fine. Now, you hold your family member a little bit closer, saying, I love you, just in case you never know what might happen,
Again, our heartfelt thanks for the energy, innovation, and patient focus that you bring. I am proud to work alongside you as you care for our friends and neighbors.
So it's definitely hard. I've had family members call me crying, wanting to talk to their family, and all we can do is Skype them and get them in. It's just hard to watch.
To walk in and watch patients who have been here for months look at you and tell you that they're struggling to breathe and that they're tired of breathing is probably one of the hardest things that I've had to do, knowing that I'm doing everything I can for them and that sometimes it wasn't helping them, it wasn't enough for them. You know, I've held the hands of many patients so they wouldn't die alone, and on the other end of it, I've also had the great reward in taking care of these patients for months at a time and watching them discharge home.
The hospital just launched a social media campaign to try to keep the hospital from becoming overwhelmed.
That social media campaign that you mentioned is called Love Your Neighbors and Friends, Wear a Mask.
The threat of our community being severely overwhelmed in the next 3 months is very real. Our staff is tired, yet they continue to risk their lives and their families to care for you, our friends and neighbors.
I would like to talk specifically to the people in the virtual hospital and give you my personal heartfelt thank you for what you did for me and my wife during this episode. Your understanding, your caring, your sincere caring for us will be most appreciated, and I won't forget that.
And I think if I were to identify one group of healthcare providers or caregivers that work in the hospital that put themselves at the most risk by just doing their job, would be respiratory therapy.
I actually feel the most difficult thing is when you have a patient beg you them not to let them die. And you progressively see them worse. You hold their hands, you rub their head, try to let them know everything's be okay. But eventually, you know they're gonna pass away. You try to make it as easy as possible to let them know that you're here for them. That's the hardest, difficult part about COVID.
I think that it's wonderful that we finally have it. It's great. People don't really realize how bad COVID is until they work with it.
I think this vaccine means a lot to my patients, specifically because it's disproportionately affecting them more than anyone else in this population. And so not only will it save their lives, but it also spares them of the social isolation they've been feeling all these months. So it's, I think, an awesome day today.
2020 has been a year of challenge and change. It's also been an exhausting year as we're all dealing with the effects of the pandemic. It's happened to all of us. It's closed schools, restaurants, theaters, and we've also been through a very contentious presidential election. Like most of you, I'm glad to put 2020 behind me and look ahead. There's something about a new year that just gives us all hope.
Our teamwork is phenomenal. Not only on the cardiac care unit, on our COVID unit, in our ICU, our teamwork is phenomenal hospital-wide. It's rewarding to see the impact that we've been able to make on the patients' lives, but it also has been tough at times because we have lost a lot more patients than we want to. And for me, that's what's hard, is because I want to be able to do the most good that I can. And there were times that just making the patient as comfortable as they can while they were passing away is all you can do.
I'm reminded every day that I have more than 2,000 reasons to be thankful. You understand that we are a team, and we are in this together for the patient. Our purpose is bigger than ourselves.
Good morning. we are so excited to be hosting the community clinic here. It is phenomenal. We just started and people are already rolling in, so we're excited about helping make our community safe.
We've been able to work collaboratively with the Burke County Public Schools, the Burke County Health Department, the Burke County Commissioners, and Burke Emergency Management to hold these public vaccination clinics. The collaboration between these organizations has made Burke County extremely strong in our fight against COVID. We want to thank everyone who is coming out to get this vaccine. They have all been so positive.
I'm just tickled that I'm going to get it.
We have vaccinated over 6,000 people in Burke County as of February 1st. That is truly awesome.
Mary Ellen Witherspoon. My daughter had COVID back in March, and she almost didn't make it. So this is very important to me that people get this shot and get this over with.
As I stand here today, I think we're still dealing with about 60,000 new cases and about 1,000 new deaths every day in the US from this virus. It's very different from the 300,000 new cases and the 4,000 deaths per day that we had at the end of Jan.
I'm glad that it's over. I think that's, and I'm glad that, you know, we're at the hopeful tail end of this and we have a vaccine.
And as I reflect on what I have seen you do during this time, I say the term healthcare hero perfectly defines our teammate. You have without hesitation gone to work, done the best you can do, toughened up to facing the unknown while taking care of your friends and neighbors. So let's continue to reflect on the experiences we've had over the past year and how much we've endured together. I cannot imagine a greater privilege than leading an organization with such incredible and inspiring people. Thank you.